If sex has become painful, uncomfortable, or something that you've just kind of quietly started avoiding, I want you to know it's not your fault. This is not something that's all in your head, and this video is for you. My name is Andrea Martin. I'm a women's health nurse practitioner. I'm a Menopause Society certified practitioner, owner of Glow Health, the menopause practice. The biggest thing is that we see a big decline in estrogen. Estrogen is the main hormone that promotes health in these tissues, and when it drops, we really start to see the effects. One of the big things that estrogen does is it increases blood flow to the tissues, and blood flow is actually what helps us to lubricate. So if you're not getting enough blood flow, you might not feel as well lubricated. Additionally, the tissue becomes very, very thin. We lose that thickness. When tissue is thin, it becomes super friable. So even a little bit of friction, a little bit of touch can be very painful. The vaginal opening can actually shorten and narrow over time. Sometimes the inner labia, the labia minora, we can lose them altogether, or they can just get smaller. And these are actually very important for arousal. We actually lose the fat underneath the labia here, which is stupid. It's like the one area of our body that's, why do we lose fat there? There's so many other places we'd rather lose fat. So without that cushion, sometimes you can also have a little bit more pain there. When you put all of these symptoms together, vaginal dryness, irritation, burning, sometimes you're tearing a little bit during sex, change to the outside, the vulva, you can even have sensitivity in situations that have absolutely nothing to do with sex, like wearing tight pants, riding a bike. All of these changes together are something called genitourinary syndrome of menopause. Really long name. We are encompassing everything: the vagina, the vulva, the clitoris, the bladder, the urethra. In addition to the changes that we see to the skin on the outside, there's also changes happening to the musculature underneath. This is your pelvic floor. It is a literal bowl of muscles that sits between your hips. In the front, we have the pubic bone. In the back, we've got our tailbone. With lower estrogen levels, it also affects our muscles. So the muscles can be a little bit less elastic, a little stiffer. Sometimes when the muscles become too tight, they clench, they don't know how to let go. That can absolutely lead to pain, as well as constipation and difficulty emptying your bladder. What do we do when we are having pain and sex is uncomfortable? Number one, we have to treat the skin. We have to treat the tissue. Very easy and effective way to do that is by using vaginal hormones. The most common, and I think one of the most effective treatments, is just a tube of vaginal estrogen. Take your tube of cream, squirt a line out on your finger. You're gonna take half of your blob and you're gonna go inside the vagina, do a little swoosh, smush it around to help it absorb. Then take the rest of your blob and you really wanna just kind of coat all the skin on the outside here, all around the opening. That's usually the most tender and painful part that needs it the most. If you're not a cream girl, you can use a tablet, teeny tiny. Comes in an applicator. This just goes in the vagina and in it goes. It's a lot less messy. However, the downside is it's, kind of a dry tablet and it goes all the way inside. It's really not as good as at treating this area on the opening. So if the majority of your pain is out here, the tablet might not be the best option for you. But if it's really just internal dryness that you're dealing with, that would be a great option. Another option that's kind of a little bit of a crisscross between the cream and the tablet is this suppository. And it has that same amount of estrogen in it, but it's mixed with a little bit of lubricant. It gets a little melty, and you can kind of spread it around on the labia. Another one of my all-time favorites. This is a little suppository, and the main hormone in this is called DHEA, kind of like a parent hormone of both estrogen and testosterone. So you get both hormones to treat the vagina, the vulva, all the spots. For some people, sometimes you have to add this into the mix to kind of get over the finish line. It's a really great product. And finally, another favorite of mine, I call it the set it and forget it method. This is the E-string. It is a silicone ring, and you just kind of squish it. It goes into the vagina, push it all the way up in the back. It stays in there. And this slowly releases estrogen to the vaginal tissues. This is also really excellent for women with poor dexterity, who are in nursing homes, who are at high risk of urinary tract infections. You can have a medical professional put this in for you and just go to their office maybe once every 3 months, have it changed out, and be protected against urinary tract infections. I absolutely love this method. So now we have fixed our vaginal tissue. It feels great, but our muscles are still tight. They are clenched. What happens is over time, when that skin becomes really dry and tight and irritated, That teaches our muscles something dangerous is going on, something's not quite right up there. So they start to clench. And the longer you're dealing with pain, the more clenchy they get, the more they forget how to let go. Pelvic floor physical therapists are absolutely amazing at treating this. Intimate Rose has wonderful, wonderful physical therapists who can help treat you from the comfort of your own home, and they are available nationwide. There's tools like dilators. Are these soft, flexible tools? They come in smaller sizes, they come in bigger sizes. It's just one size, but you can use this to just gradually stretch the vaginal opening, doing your deep breathing, maybe working on meditation, things to downtrain your nervous system, and this is a great way to help those muscles unclench. One of my other favorite options is a pelvic wand. This one I love because she vibrates. Vibration is fantastic for breaking up like tense, tight muscle fibers and fascia that's bundled together. It increases blood flow. It also confuses your brain a little bit. There's only so much intake of sensation our brain can handle at once. So sometimes that vibration will kind of override the sensation of pain. Other things to think about. You may have heard about vaginal moisturizers and vaginal lubricants. They are all very helpful to add into your regimen. So vaginal lubricants are specific to sex. All a lubricant is going to do is prevent friction. If, say, you're on a regimen of vaginal hormones and you're like, I'm feeling a lot better, but I still feel kind of dry in between doses sometimes, that's when moisturizers can be fantastic. You can use them as much as you want, and it's just really soothing to the skin. I hope this information has been helpful. The one thing I really want to drive home is that genital urinary syndrome of menopause is progressive. It's not something that if you ignore it, it'll go away, or if you treat it for a couple of months and then stop, you'll be fine. It truly can get worse and worse over time, so this is something you need to get ahead of. Additionally, you do not have to accept pain as the price of getting older, or it's the price if this is just what you do when you're in a relationship. There absolutely is a treatment plan that would work great for you. Continue to follow along and subscribe to learn more about your pelvic floor and menopause.